My philosophy is that children are resilient. It's really, really hard to quote screw things up. Children are resilient, parents and caregivers are resilient. And I would say that 90% of the time, if not more, we find our way. Hello and welcome. We're so glad you're tuning into the Taking Good Care show. I'm Dr. Andrew Wong, based in Toronto, Canada.
And I'm Dr. David St. Arno, based in Edmonton, Canada. We're two practicing psychologists with over a decade of experience each, working in a variety of settings and supporting diverse populations.
Thanks for joining us. We hope you enjoyed today's episode. While we're both practicing psychologists, our podcast is intended purely for educational and entertainment purposes. It's not a substitute for professional mental health care or treatment. If you're in need of support, we strongly encourage you to reach out to a licensed mental health professional in your area.
Good morning, Andrew.
Good morning, Dave. How are you on this lovely Friday?
Well, still recovering from the Oilers' loss, but I think I'm on the mend. I'm starting to, shift my focus, and yeah, I'm not quite there yet, but I'm on my way. I can't even look at next year yet. Yeah, I'm actually looking at my kids play soccer. I'm looking at the school year ending. I'm kind of like honing in on the important pieces in my life right now, and not so much focused on any pro sports.
Speaking of the school year ending, today's episode is about children and children in therapy. And usually at this time of the year, at least at our clinic, some referrals do slow down. The pattern that I've also often seen in terms of referrals, it's September, October gets busy. Many students sort of go through the period, the honeymoon period, as I call it. School year starts off, it's going great. And then as the year progresses, teachers start to notice things, parents start to notice things, whether it's behavioral or academic or both. Um, and then our referrals just spike for the rest of the year. And then come June, things are finishing off, teachers are tired, and everybody wants to just have a nice, relaxing summer.
I mean, this is not what this pod or this episode is about, but you bring up the point about like noticing patterns in at least private practice, kind of when things get busy and when things slow down. I've seen, sometimes the summer speed like gets busier for the students that their parents don't want them to miss any school, right? And so now there's free time to be able to make it into, at least during regular business hours, to the office for therapy. I've also seen sometimes when benefits renew, right? In
Oh, yeah.
January, all of a
Yeah.
sudden
Yeah.
there's, because resources can be a limiting factor for a lot of families, especially with the private practice. So maybe we'll talk a little bit about like, private practice versus public access to therapy for kids and teenagers, and a lot of friends and family will contact me and say, should I bring my child in to a psychologist or to a therapist, and how do you make that decision? So maybe hopefully we can, at least share our insights around that and help some parents that might be trying to make that decision right now.
Yeah, it's so interesting. So my clinic, I would say probably 80% of our clients are children and teenagers. It's from my experience, I worked at a school board for almost 10 years. And then from there, your name sort of spreads. And so when I started my practice, I could practice with children and adults. But it just so happened that a lot of the referrals were coming from people who I already know in the community. And so lots of children and teenager referrals. It's a good question. When do we have children start therapy? I could give a very broad stroke answer and say, hey, therapy is good for everyone. But I think to your point, resources can be limited, time is limited. I know that every family is very, very busy. So sometimes therapy may not be, the first thing on everybody's minds. But I would say, in terms of starting therapy, I see a lot of clients and caregivers who will come and say, you know, This was a recommendation from a principal. This was a recommendation from a teacher. These are some of the behaviors or academic challenges or both that they're seeing in the classroom. And because we're not in the classroom with our children, they think that it's wise for us to seek out some help. It's so diverse in terms of when people decide to start. You have parents who, when I worked at the school board, they'll say, well, we're not seeing this at home. So, whatever you're seeing at school, whatever, right? It's not worthwhile to pursue. We'll let the school handle it. And sometimes the whole therapy process or seeking help process doesn't start until things start to bleed over at home.
Yeah, and I think like with any therapy, adults, children, you can wait too long and things get worse. And so earlier can be better. But I also know there's a lot of like research where people are on wait lists and not getting any therapy and they get better, right? So how do we decide whether we just need to keep monitoring and doing the best we can without extra supports and that things will likely get better? Or when is it time to bring in supports or get therapy for your child?
I might be doing a lot of talking today, Dave, so I hope you don't mind.
I'm leaning on you because this is your jam. So
It's a good question. Do we sort of let things ride and do things resolve on its own, or do we seek out help as early as possible? I'm always of the mindset, especially with children, to be sort of a detective. As caregivers, as adults in the child's life, understand what your child's patterns of behaviors are, and look for those changes in behaviors. I always tell every parent who sees me as they're talking about their children, I will always say, you know your child best, right? So I will have, for example, a parent who might tell me my child has started to do some odd behaviors. You know, Maybe they're scratching their skin a little bit more, or, for whatever reason, they don't want to go to swimming, and I'll ask, how long has this been? Right. And during a consultation call, or I'll have my intake coordinator ask, how long has it been? And they might say, oh, it's been about a week or two. Oh, it's like, okay. So it's been a week or two, but it's been about a week or two. Do we necessarily have to jump into therapy right now? How debilitating is it? And I think that's a crucial word for me. How much of life is it getting in the way of? Are they scratching to the point of breaking skin every day? Or are they getting to the point where, like, let's say they don't want to go to swimming and they're competitive swimmers? Is it like the whole week when they haven't gone, or the whole 2 weeks that they haven't gone? Or is it just a sprinkling here and there they're not wanting to go? And so, depending on the severity, depending on how debilitating it is, I might say, you know what, let's monitor it for another couple of weeks, right? Because I don't know about you, Dave. When I see so many children, even my own sometimes, you might have certain patterns where it's like, that's odd. I've never seen that before. Let's see how it goes for the next few weeks. And then sometimes they do resolve.
Absolutely. Yeah. I think, I'll throw out a bit of clinical jargon here, but when I'm thinking about parents, having concerns about their kids or me having my own concerns about my own children, I'm thinking severity, like you said, how bad is it? How severe is it? How much is it negatively impacting their life, their relationship with teachers and friends and parents or other caregivers, sports, all those things. So severity, frequency, how often does it happen? And then duration, like how long does it last? So if we're looking at, depressive symptoms, or if we're looking at aggressive symptoms, or difficulty with emotion regulation, if it happens once a month, then maybe you just hang off a bit and see if it resolves itself. But if it's happening on a daily basis and it's happening for like over half an hour and it's really causing disruption at home and at school, then those are indications for me. It's like I would get in to see someone sooner than later, at least to get someone kind of assessing or evaluating, getting another perspective on how severe, how frequent, and how long does it last even in the psychologist's office.
Absolutely. And this is where too, working with children is, I think this is one of the main differences between working with children and adults is children's brains are evolving and developing so quickly. So, I've worked with kids where 1 year, um, they were highly dysregulated, getting into fights at school, yelling, screaming at home. Um, and then come the following year, it's like that maturity kicks in and it's like completely different child. I'm not saying that this is the norm, but I'm also saying that I've seen a number of kids go through that maturity phase where they get to like grade 4, grade 5, and like everything has just mellowed out. And it's not to say, let's say between grades 1 and 3, that they shouldn't get help, but it's also like sometimes reminding parents we do have to get through the storm and we will have strategies to get through the storm, but also don't try to prognosticate, 5 years, 6, 7 years from now. Take it one day, 1 week, 1 month at a time, and we will weather this storm.
Yeah, I remember doing so a bit of my background was doing my full year internship for my master's was at a school board. So I was doing psychoed assessments and as well as counseling within the school. Um, so when I was doing the psychoed assessments, we would often, encourage parents to wait a little bit longer, like not get something done in kindergarten, grade 1, grade 2, but grade 3 is kind of that age where a lot of the things become more uh, so like say a kid's reading level is behind in grade 1, they might catch up in grade 3 without any intervention, right? And same thing with, like you're saying, behaviorally, a kid might have difficulty, emotionally regulating or controlling their aggressive behaviors, right? But just through maturation, just through, the way kids kind of grow and change, it'll resolve itself without any intervention, right? Because the variability at younger ages, the younger the child is, the wider the variability is. So the what is typically normal is a lot wider than when we get past grade 3. That kind of narrows down. So that's one advice that, we would tell parents in the school. And I think I still tell parents now, like maybe give it a year because your kid is still quite young and
Yeah.
they're still kind of in the normal range, even though it's on the one end, it's still not that abnormal.
And this is oftentimes where I also go back to parents and ask them to compare any kind of behavior or progress or even academics with that's relative to their own child, right? Sometimes I'll get parents who will be like, I see all these kids in the schoolyard and they're not doing this or they're not doing that or they seem so much more advanced, quote unquote advanced in a sense. And I always go back and say, well, where has your own child progressed? Right. So taking the lens of that comparison with other children, because I find that in a way, like it can be so difficult for parents to compare their own children with other children. Like we have no idea where other children's backgrounds are. I always say every brain is hardwired differently. And so I always go back to parents and say, well, compared to last year, where was your child? Has there been progress made? Versus let's compare your child to 30 other kids in their class.
Yeah. Well, I think that's where we can add value is because a lot of parents will be comparing their kids to their other kids, to their siblings, and go like, well, the older one didn't have any problems like this, and this seems like really concerning. And then they might compare to the other classmates or maybe to other peers at like on a sports team. And my kid's not as coordinated. Is this a problem? So a psychologist or anyone like a therapist that specializes working with children and teenagers, part of the training is developmental stages, like understanding child development and understanding what is typical and what is not typical and being able to we even have like checklists and scales that'll allow us to parents to rate things and then
Yeah.
come up with like the results saying this is concerning or this is kind of in the at risk, keep monitoring, or this is typical. This is kind of normal for kids this age.
Going back to your question though about when do parents take their kids to therapy? So we've talked about the severity, frequency, and monitoring. The other piece I also want to add is what is your capacity as a caregiver? Just like you would as an adult choosing whether or not to seek help, you know, typically we as adults will seek help because we're feeling stressed, we're feeling overwhelmed, and we don't know what else to do. It's sort of the same thing for caregivers, right? And every caregiver will have their own capacity. So again, I will get parents who will say, well, I don't understand why I'm feeling so overwhelmed as a parent versus these other parents whose children may also have certain issues, but they're not seeing a psychologist. Like, why is it that I feel like I need to? Again, everybody is different, right? Your capacity as a caregiver, your dynamic with your partner, is going to be different from everybody else's. So if you're feeling overwhelmed and stressed as a caregiver, then perhaps it is time to go seek assistance.
Yes, yes. And I think for anyone listening out there, if you think you're going to take your 5-year-old child and drop them off at the psychologist and they're going to come out, different, possibly, but so the younger the child is, the more involved the parents will be in therapy typically. So I know we chatted a bit about this before we started here today, but our own process, I think, you know, kids can't control their environment. So sometimes their behavior is a way of expressing themselves, even though we might not appreciate it. It is self-expression because again, younger the kids are, the less language ability they have.
Yep.
So they're going to behave certain ways. And involving parents either before, during, after. I still remember my training at the University of Alberta where we had the play therapy room and it had one-way glass where parents could actually observe the entire session and see what was going on and possibly even have support by another psychologist or a supervisor that would be able to coach the parent in terms of like, hey, see what's happening there right now with your child. You might want to try this at home. So parents are learning and the kids will also be learning.
I remember those were like the pressure-filled days. When
Oh,
you
you were being observed. Yeah. Yeah.
yeah.
Not the child. Yeah.
When
We were.
you're a grad student and it's like, oh man, like, do I know what I'm doing? We've got these parents watching. We got my supervisor watching. We got a peer watching.
I love that you brought that up. I think, even for parents too, right? There's a lot of shame and a lot of like uncertainty. If I'm bringing my child in and I'm going to be meeting with a psychologist, are they just going to, blame me for my child's behavior? Of course, right? It's kind of scary.
There's so much to unpack there, right? Like, there's so much to unpack, even when I meet with parents for the first time. So, my process, Dave, I don't know if this is for you, but my first session with younger kids, I would say maybe nine and under, is to definitely meet with parents first. And that really gives me an idea of the history of the family dynamics. What are the parents' concerns without having to divulge everything in front of the child? Because children understand, right? Children know to a degree, what the parents are talking about. And sometimes we don't want to be completely transparent in front of our kids. But when I have that very first parent session, it is a time to be candid and to be forthright and say, hey, like, what are the issues? What are your concerns as parents? And all sorts of things can come up, whether it's, like you said, parenting shame, right? What are we doing wrong? And whenever I hear those words and we're using absolutes like right and wrong, I'll say, you're not doing anything wrong. And I just used this line this morning with another parent, actually. There's no parenting manual. Yes, there are thousands of books out there, but let's think about it for a moment, right? Why are there thousands of books out there? Because there's no one prescribed manual. Everybody has an opinion about parenting, which I think it's a phenomenon, to be honest. When I was a new parent, everybody from grandparents to friends to neighbors, everybody had an opinion of how we should raise our children. Don't do this, you should do this. We've done this for years, you should be doing that. But at the end of the day, my philosophy is that children are resilient. It's really, really hard to quote, screw things up. Children are resilient, parents and caregivers are resilient. And I would say that 90% of the time, if not more, we find our way. Now, could we use some of these books as guidance? Absolutely, right? Articles, books, videos. But are they the Bible that we must follow? No, right? This is why everybody thinks that they can write the book on parenting.
Well, because it's how they were raised, or it's
Yeah,
what worked for them, or what they yeah. So I like that there's a metaphor from Russell Barkley's book on ADHD, and he says like parents need to be a shepherd. They're not an engineer, right? We
yeah,
are not engineering our children to be a certain way, and we're kind of working with what we got, right? And so figuring out what are the kids' kind of abilities or even disabilities? What are their strengths? What are their weaknesses? What are their interests? And that can vary from kid to kid and even within the same family. So a lot of times we're helping parents understand what are reasonable expectations for their child based on kind of where they're at. And then that might take some weight off of them, right? It
yeah.
might kind of relieve them a little bit. I still remember doing a parent-child group at the clinic at the U of A. And so the kids would all meet. It was an anxiety group. Were you with me for that
I
one?
don't think I
I
was with you. Was this at the hospital?
No, it was at the education clinic.
So mine, I did a similar thing at the hospital though.
Okay.
Yeah,
So the group involved having all the children get together, and I was involved in that. I was kind of leading the anxiety, cognitive behavioral approach to helping these children. But the parents, because they were bringing their kids there and there was nothing else for them to really do, the parents all got together, and my supervisor was, helping the parents kind of sharing some psychoeducation information, but it
yeah.
wasn't supposed to be, the most important part of the therapy. And but what we found at the end of it was the parents got the most benefit from hanging out with each other and
Oh, for
talking about the
sure.
challenges they were having and feeling like they were less alone, because it can be very isolating for parents to have kids that have challenges and not feel like any other parents are struggling in the same way.
Yep, normalizing the experience, right? We find that actually very effective for children who have autism spectrum disorder.
Hmm.
The power that it gives parents to know that there are groups of parents out there who may struggle with similar things. Just being able to get together and have a conversation, have a coffee, and just know that, well, we're not alone. Yeah, and I think to your point about that idea of involving parents, I think you and I are on the same page. But certainly, I have heard of other clinics or other clinicians who will just take a child for 50 minutes to an hour and then come back out and just hand it back over to a parent. And that's never been my style. And the way I explain this to parents is that, look, if your child is only coming to see me once a week or once every other week, that's only 1 or 2 hours max. But you are with your child almost the entirety of the day, minus 6 hours for school. And that's if they're not on summer vacation or winter holidays and stuff. So I always involve parents. So, whether it's a parent session or having parents come in for the first 5 to 10 minutes to speak about how the week or the couple of weeks have gone, and then I'll spend my time with the child working on certain strategies, trying to gain some insight into their experience, and then bringing the parent in for the last 10 minutes to debrief and say, like, this is what we talked about. These are some things to work on for the next couple of weeks. To me, that's where the value is because I can't expect a young child to try these strategies on their own. I will guarantee 100% of the time that it's not going to be worked on by themselves.
Absolutely. Yeah, we are on the same page. I don't I don't have a lot of younger children on my caseload right now. So a lot of where my brain is at is more with the teenagers that are on my caseload. And even with them, and I think you said like 9 years and lower. So yeah, myself too, it's kind of that 10-year mark is
Yep.
where I might shift my approach a little bit, depending on the maturity of the child too, right? So um but with teenagers, I'm often, I'll have the first meeting with the parents and getting a good idea of their concerns and why they want their child to be there or why someone else thought their child should be there, why their child maybe is asking for this. And then after that, when they're coming in, the first 5, 10 minutes, I'm having the parent in the room say, how are things going?
Yep.
What are your thoughts? How do you see your child? And good and bad, right? The progress they've made, the concerns that are happening at home. And then the parent leaves, and I chat with the teenager, and we talk about, we go where we need to go, and then we may or may not involve the parent at the end of the session. I'll have a conversation with the teenager towards the end saying, should we bring your parent back in and debrief them, or do you want to handle this on your own? Do you want to talk to them about it outside of the therapy room? Um, and I'll also share if I feel like there's something that really needs to be shared. And for all parents out there, anytime there's significant, concerns, immediate concerns about safety, whether it's the child or someone else, those are
Yep.
things that parents will get notified, no, regard or should be notified no matter what. And the child knows that too in advance. But outside of that, the older the child is, the more privacy I have with the teenagers.
And I think for all the non-clinicians who are listening, in Canada, there is actually no age of consent in terms of therapy, but there is precedence that's been set in case law that typically the above 12 years old, we can sort of assess the maturity of that preteen teenager to see if they can consent for services on their own. And this is where a lot of caregivers and parents, this is news to them too, that by that age, if we think that they are quite mature for their age, they can make the decision that, oh, I don't want to share anything with my parents. Right now, of course, this is always on the discretion of the clinician. And so I'm still hard pressed to say, like, someone who's 12 or 13, maybe even 14, to say, yeah, they can consent by themselves. But where we do get into the tricky ages is like 15, 16, 17, where the parents are like, well, I'm taking you here. I should be allowed to know all this information. And you have a teenager who's sitting there going, no, I don't want it. I don't want my clinician to share anything with you. And this is prepping for anybody who is planning on taking their child or teenager to therapy. Technically, if your teenager is mature enough to say no, I don't want to share information, as a clinician, we have to abide by that.
Yeah, and always for non-clinicians, everything is related to therapy. So maybe this is an issue between the parent-child in terms of privacy, in terms of wanting to know more information than the child wants to share. Like that might not have been the focus coming into therapy, but that is something that it just showed up, right? And it shows up in our office. And I was kind of smiling because you're saying we could assess the maturity of the child and possibly have them consent for themselves. But how many kids can pay privately for their own therapy, right? Like, so even if they could consent for themselves, could they even afford the therapy? Well, so this happens more in the public sector where they would go see a doctor or go see someone within like a primary care network, clinic. They might assess them to be more mature enough to consent for therapy. But I always default to like, why would you not have the parents involved, right? And
Yep.
sometimes there's safety concerns that need to be considered, especially I did a research project with at-risk youth that were, a lot of times kind of living outside of their parents' home because of things that had happened in the home. So from an ethics perspective, it was approved that we didn't need parental consent because it might actually put the kids at greater risk of harm.
Yep.
So there are considerations like that, but my default is always like, let's involve the parents as much as possible, right? Because they are a big piece of this child's life.
I should also add too, so I don't get in trouble with my colleagues, depending in Ontario anyway, depending on what kind of services you're receiving, in what capacity, in what setting, the ministry that it falls under. There are different ages, but in terms of you're laughing, but I'm serious here. Um, we could get in trouble, but in terms of private practice, there's no there's no number for age of consent. But if you're working in education, you're working community services, different things there. So I should add that before I get in trouble.
Well, and if we're covering our butt here, um, I'll also say like parents that are not together anymore and there's joint custody or
Yes.
parenting decision making, shared parenting decision making, you need both parents' consent. So one parent brings the child in and you start seeing the child and then you're like, "What? Oh, you guys your parents are divorced or separated." Oh, geez, right? So the first question, often is like, what's the custody arrangement or what is the parental arrangement? So if the parents are together, then only one parent needs to consent.
Yep.
So you do
Yep.
need to ask those extra questions and before you get yourself into trouble if you're a clinician out there listening.
Yep. For any caregiver who is seeking services, all of these things should be stated right up front. And it's really important for all of these details to be discussed. I know sometimes these details, whether it's about separation or divorce, might be sort of sticky issues, but it's better to know at the beginning about that particular clinic or that clinician's guidelines and ethical obligations before we fall into any traps and, things are getting even messier after that. So that would be one piece of really sort of, I guess, technical advice I would give
Hmm.
for caregivers who are seeking services. Just make sure everything is explained up front and be very clear. And if you have questions, ask away.
Yeah, I think because, I've even seen it. Our practice, the practice that I joined, they have a pretty clear process, and I was able to piggyback on that. But, other people that have joined recently or other people that in the community, well-meaning people that want to help kids, right?
Hmm.
And all of a sudden they're 5 sessions in, and the other parent says, "Hey, wait a minute, I didn't know my kid was going to therapy. I want to
Yep.
know what's going on. I have a right to know." And it's
Yep.
like, they do have a right to know. So now
Yep.
you have a relationship with this child. Now what do you do? Do you end therapy, refer them to someone else, and then the child kind of could be, suffering from it, right? So as much as you can, making sure if you're doing this work, you're upfront and you have a clear process and everybody involved
Yep.
understands the process. I mean, it's kind of a no-brainer in therapy, but the more people involved, the more potential for mistakes to happen. Just, again,
Pitfalls, right?
well-meaning. Yeah.
Pitfalls.
Yeah. Yeah. And that's why working with kids is more complicated.
I have had situations where I will have one parent, again, separated, and they'll say, I don't want to be involved at all. Okay, so if that's the case, give me something in writing that says you don't want to be involved, but you will have the other partner or ex-partner involved. That's fine, right? As long as I have something in writing that states this. I'm going to change gears a little bit in terms of the types of therapy for kids. Because this is the other thing that I often get asked is, what is your approach? And is this approach going to be helpful? And I would say that working with kids, and this is not to diminish the work with adults and the flexibility you need to work with adults too, but working with kids, I've often found myself being very flexible, even with some children. You know, one week you might be having an awesome session, and the next week they're upside down, hanging off a chair or, your windowsill, and it's like, whoa, what's happening this week? And so even though as a clinician you might be prepared with some activities, it might not go as you think, right? And parents will ask, what kind of therapy do you do with children? And I would say you modify, like we've talked about like emotion focused therapy, we've talked a little bit about cognitive behavioral therapy and play therapy, but I find with children it's hard to subscribe to just one particular modality because children again are so different. So for me, it's yes, we can work on cognitive behavioral strategies sort of in a childlike format where we talk about How do you feel? How is this impacting your thoughts? What kind of thoughts are you having? How do we change some of these thoughts? And how do we impact the behavior? Again, using very childlike strategies. But I often find the rapport to be the most important piece of the therapeutic process with kids. And I've heard from many parents, and they'll say, you know what, we've been to another therapist. My child really didn't want to go back. And this is not to boast about my particular skills, but over the years, I've really worked on being able to refine creating rapport with kids. And a big part of that is just getting down to their level during the first session and, not necessarily asking about quote unquote the problems. No child necessarily wants to come into an appointment and just start talking about everything that's negative about themselves, even though the parents might want them to.
For
That's
sure.
not their objective.
Yeah, across the board for all therapy, the relationship, the therapeutic alliance or relationship is probably one of the most important pieces. So whether there is a good connection there, whether the kid feels cared for, connected to whoever they're meeting with is kind of essential, right?
And I will often tell children and parents too, because parents will be like, well, I haven't told my child why they're coming, who you are. And it's like, just use my name, right? Visit my website. They can look at my picture. You don't have to call me doctor, whatever. Just use my name. And my particular suggestion is always to not focus it on the child and say, well, you're coming because you're doing this and you're doing this. We're trying to improve as an entire family or as an entire unit, right? We're trying to make improvements. So it's not just for you, it's for mom and dad as well, or it's for a sibling too. And you take that spotlight and you diffuse it a little bit. So it's the spotlight is now bigger, right? And it's for everyone.
So
Yeah.
you meet with the parents, and then the parents, you might tell them, you know what? I don't think you need to bring your kid in right now based on what you've told me, but you know who I am. I know your history now. You keep me in your back pocket further down the road. But if the concerns do seem to be like appropriate and therapy seems to be indicated, then you say, okay, next step, bring your kid in. And
Yep.
oftentimes the parents will say, well, how do I tell my kid? Like, what do I say to my child about bringing them in? And you can coach them a bit on that in terms of like, hey, I'm here to help the family. That's what kind of like
Yep.
you said,
Yeah.
diffuse it a little bit. Like,
Yeah.
my job is to help your family. I'm trying to figure out what's going on with your family, what's working well in your family,
Yep.
what things might be hard for your family. So yeah, that's where I start. And when I'm meeting with the child, I often say, what did your parents tell you about coming to see me? Right. And we have like soft drinks and juice and other stuff like,
Snacks.
yeah,
Snacks are
snacks.
key.
And you say, hey, help yourself. When you come here, you get to pick what you want as long as your parents let you, right? As long as it's okay with your parents. So we're building that rapport, that relationship, even in the waiting room, right? Trying
Yep.
to let kids feel comfortable. We have kids' books in our waiting room too,
Yep.
right? So it's, yeah, it starts, with meeting with the parents, and then it
Yep.
keeps going.
Yep. And then we have coloring. I always have coloring ready. I'll have a puzzle ready. Connect 4 is a game that's not too stimulating, but it gets them engaged. And then once the therapeutic process does begin, again, it's not necessarily having a child, and I'm thinking like let's say between 6 and 11, it's not having them just sit there and tell you about their lives because with some adults it's already difficult enough to just sit there and be asked questions and to tell their story. Think of how difficult it is for a child. Right. So this is where like I might pull out the Connect Four, I might pull out the coloring, and yeah, we'll color, we'll play the game. But during that play, then we're having the conversation, right? Then we're asking the questions. But the beauty of this is that the spotlight is not on them, right? Their brain is being occupied by the game, by the coloring, by the puzzle, but they sometimes don't even know that, oh, I'm telling my clinician all of these things. I'm telling my psychologist all of these things while they're occupied with their hands on something else.
Yeah, and it's a fluid process, at least for me. So we're constantly, as clinicians, we are assessing and then we're intervening. So we're either
Yeah.
monitoring, watching, trying to understand what's happening, and then we're doing something and seeing what happens when we do that thing. So with kids, it could be a lot less talking and a lot more moving things around, their imaginary play, and we're just joining them in their world and we're looking at like what are their communication skills like developmentally, where are they at compared to other children their age. We're looking at their emotional expression, self-regulation. I love playing games that the child loses and we get to see what that looks like.
Yeah.
um, oh, and even depending on the age of the child and how involved the parents are, we're looking at the parent-child relationship like in the therapy room and looking at that connection.
This is where in the past I've even asked parents, hey, can the other parent bring the child next time?
Hmm.
Okay, let's see what it's like.
Yeah.
Or on occasion, I know at the beginning I talked about having a parent in here at the beginning. Depending on what that relationship is like, there may be occasions where I'll be like, you know what? Let's not have the parent in here today. We'll have a separate parent session. But because of the dynamic, you know, whenever the child and the parent are together in the therapy room, it gets really combative, conflictual, and so we'll say maybe not this time, right?
Hmm.
And we'll have a separate parent session to discuss what's going on at home.
Yeah. Yeah. Or you might even have the child kind of come up with what they want to say to their parents and do that in the office with you and your support. And again, we're always looking like whether we're supporting something or whether we want to maybe shift something a little bit. So
Yeah.
intentionally.
Yes. No. And I think it's important for caregivers to hear this is that many of the things that we do may seem very subtle and nuanced, but there's a reason for it. Right. So let's say we weren't able to brief you prior to the appointment, but we say, hey, today, can I just start with Johnny by himself? Know that there's a reason, and it's not just that we want to shut you out. Right. And perhaps we can explain it to you after.
We should be able to explain our reasoning to parents, right? Of course, when they
Exactly.
ask these questions, and especially if they're not familiar with, play therapy. What are you're just playing games with my kid? I can do that at home. Like, why would I
Yeah.
pay someone to play games with my kids?
So this is why, like for me, I think it's so important to keep parents involved, right? Like, and I don't know if I'm shooting myself in the foot here, but to me, if I were to bring my child to a therapist, and I never get to talk to the therapist, that would be a big red flag for me. Personally, that would be a big red flag. Um, because I want to know what's going on. I want to know how to help my child. So you bring up play therapy and play therapy can be very helpful. I would say not for every single child, because early in my career and during grad school, like you try play therapy and it's a disaster because the child just completely, goes a little bit overboard with the toys. But, for me, play therapy has been helpful. Like I'll pull out the Playmobil and, I've got a Playmobil of a school and I'll be like, here, let's play school with some of these characters, with some of these figures. And I've been able to gain a lot of insight about what school is like for the child, whether it's like, for example, being constantly yelled at by the teacher or a principal, and they only have negative interactions with the adults at school. Like I've been able to deduce that from play therapy. And then now we know what's going on. Why is the child acting up at school? Well, they have no positive interactions with the adults at school. Right? That is like a small example of the power of play therapy.
Yeah, kids are expressing themselves
Yep.
without using words. And, it gets tricky because we're trying to interpret, what the meaning of their behavior is. So, we're gonna kind of hold that lightly and look for patterns and look for, this happening more than once. But, there are therapists that use sand trays and have,
Yep.
sand and different figures, and they'll say same thing, like just design your home, design your school. Who's this character and who's this character? And even children that are older that are nonverbal, right? Like this is a way to get insight into their world, into their thought process, into what's hard for them, what's easy for them. And I pulled off my book from my grad studies that I still like think about all the time. It's called Play Therapy Dimensions Model.
Mm,
And really it allows therapists to move from either being like working in the conscious level or the subconscious level, where the child is either expressing themselves consciously about things that are going on, or maybe subconsciously, like maybe more through play, and also from being less directive. So the therapist is not doing a whole lot of intervening. They're sometimes even just putting words to what the child is doing and following along the child. And then on the other end, it's more directive, more active. So you're asking a child to do something or asking a child more questions. And so those are the four kind of contingents that allow me to kind of go, do I move more in this direction or more in this direction to help this specific child?
And then with parenting work too, so as I think the message for today's episode has been it's so important to work with the whole unit. And so part of working with the whole unit is working with the parents and talking about strategies at home. Do we use visual schedules? How structured are we? What are some of the parent expectations versus school expectations? Do we need to implement any kind of behavioral strategies, whether it's like using rewards and positive reinforcements? And, you know, what motivates the child at home, right? So the more I talk about it, even for a podcast today, it's like there's a lot of complexities that perhaps even because I've worked with kids and families for so many years, I don't even think about as much anymore until we're talking about it right now. As we sort of elicit some of these conversations, like to me, it's so automatic in terms of working with the whole unit that it's like, huh, it is pretty complex.
Sure, yeah. This is kind of an aside, but what is that dog whisperer?
Oh, Caesar Milan.
Yeah, Caesar Milan. So just watching a bit of that, I was like, oh, this actually relates to like child parent relationships. Like, so he talks about like how tight you're holding the leash with your dog, right? And that your anxiety can actually go through the leash to the dog, and then the dog can have these really aggressive behaviors.
Yep.
And it's like, oh man, like how much we co-regulate, how much we feed off each other in families. So it might be unintentional. You might have, you might be really concerned about your child, worried that something bad is going to happen to them.
Yep.
And then they actually have behaviors that make that worse, right? And so now it's a feedback loop that it's like, hold on, let's have a chat about this. And if the parent maybe anxiety goes down, then the child's behaviors might change, right? It's not as straightforward, but yeah.
No, it's not. And I think like we could go on and on about all the different complexities with therapy with children and teenagers. One piece I did want to get to as well is I get asked a lot is when do we take a pause or end therapy with children and teenagers? I don't know about you, Dave. For me, I don't typically use the word like terminate or end. For me, I always tell parents like you can come back at any time, but there's always sort of a measure of how far the child has come from where we started. So whether that is an objective measure or perhaps it's having again a conversation with the caregivers. Even sometimes I will have conversations with consent with the teacher to see how things are going at school. Can I contribute any strategies to the school environment? And when parents tell me like they've come a long way, like there's been a lot of improvement, I will throw it out there and say, should we take a pause now? I'm here if you ever need me, give me a call back. Or do we, instead of seeing every other week, we see every 4 weeks now as booster sessions? And a lot of parents will be receptive to that. And I'm completely happy with the plans that we make moving forward. At the same time, though, I've had parents who will say, you know what, we're sort of on a good roll right now. We don't want to change things, and we have the resources to keep coming. So, is it okay if we continue with every other week? And, I will say that I'm fine with it. But again, if the child is on a really positive trajectory, I will probably eventually still say, you know what, how about we try a month? And then let's say a month or we try a few months of that and things are still going really well. That's when parents gain that confidence to say, okay, we're ready for a pause now.
Yeah, I think telling parents, hey, from my perspective, I think your child is doing really well. Here's how, the progress that I've seen. And if the parents reflect the same thing back, it's like, how would you rather spend this hour or these 2, 3 hours, depending how long it takes to get to the office, depending like, would there be something more beneficial for your child? And
Hmm.
when that starts to flip in that direction, it's like, so yeah, let's pause. And you know where I am. You have my number. You can reach out to me. When you first started talking about it, I was thinking about the forced endings that I've had, like when I was at the school board or when I was at the clinic, where my role was ending, so I had
Yep.
to end with children and with adults and teenagers. But sometimes there's a benefit to that. It's a point of reflection and saying, what have you gained from this, or what are you going to take away from this experience now that we're done? And
Yeah.
that can be super valuable
Yep.
to kind of consolidate some of the changes that have happened that might not happen if we just kind of continue the relationship.
And for some of the older kids, I will also ask them, right, get their feedback of how things are going. That is so important too. So when they say, yeah, you know what, I've noticed a lot of improvement, or even sometimes when there hasn't been improvement from their perspective, and maybe they'll say, you know what, it's not really working for me right now. It's really honoring their perspective, their opinion, and sometimes perhaps they don't see it as the best fit, and we can re-refer them somewhere else. Or, sometimes they'll just say, "Ah, I'm just not ready right now. Maybe I'll come back in a year." Right? And that's okay too.
Well, and again, therapy might not be the thing that's needed, right? And
Yep.
so I know you said, there's no harm in doing therapy. I kind of have the same approach. Like it's generally not bad. Like if you want to bring your kid to therapy once a week and you can afford that and it fits with your schedule, it's not going to be a bad thing typically. Like there might be some issues that, especially dealing with trauma potentially or how things are handled, but generally, therapy does not have a lot of negative side effects, right? As opposed to like, say, medication or other treatments, right? So, in private practice, there's a lot more flexibility. And if you want to continue to have that support for your child, great.
Yep.
But for the parents that are really wondering, oh, I often think like if there's an infection, if your child has an infection, sometimes your immune system and their body can fight off that infection and it goes away. Other times you need antibiotics, right? And so
Yep.
when do you take your kid into the doctor to get the antibiotics? That's kind of that like, oh, this isn't going away and it's possibly getting worse. Let's bring someone else in to get some help with this.
So I know it's usually we do sort of like a takeaway message. I think for today, for me anyway, what I'm really hoping out of this episode is to have demystified what therapy is like for children, and of course then for caregivers too, that it's not necessarily, it's not a scary process. It can be a very fun one, it can be a very rewarding one. So I know this conversation can go on, but as a starter episode, I think, I hope anyway, that this helped any of our listeners who are thinking about therapy for their children.
Yeah, I'll echo the same thing. I just hope that this, kind of gives a bit of insight because not everyone can call up a psychologist or a clinician and ask these questions. So we didn't cover everything, but I hope this at least kind of points people in the right direction or gets them having a conversation with their partner or with their family members or with their children about some options that are available.
So, again, if you've enjoyed this episode or some of the other episodes or all of them, please follow, please subscribe. Certainly helps us continue to produce our episodes. And it's been a lot of fun. And in the meantime, until our next episode, take good care.
Take care.